Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. National Primary Healthcare Development Agency to roll out COVID-19 vaccination in churches. Civil servants in Edo State without vaccination cards to be barred from entering all government offices as from tomorrow. And the United Kingdom to begin COVID-19 vaccine booster program for older and vulnerable population from next week. 21 people have died from COVID-19 complications, increasing the nation's fatality toll to 2,619. The Nigeria Center for Disease Control noted that the latest figure included a backlog of 9 deaths reported from Lagos State. The state also topped the list of daily infections out of the 387 new infections recorded across 15 states and the Federal Capital Territory. Meanwhile, Borno and Kogi states, according to the census data, have no cases on admission. Here's more on the update.
387 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 15 states and the FCT, indicating a slight increase from the figures reported earlier. Again, Lagos topped the list with 114 cases. 91 cases were recorded in Rivers, 32 cases recorded in the FCT, while Edo had 31 cases. Delta recorded 28 cases, Kwara had 20, Bayelsa 18, Akwa Ibom 15, while Oyo registered 10 cases. Other states that reported a single-digit infection include Osun, Gombe, Plateau, Ekiti, Ogun, Kano, and Kaduna states. 4 states recorded 0 cases, including Abia, Nasarawa, Ondo, and Sokoto states. The latest update also includes a backlog of deaths and recoveries, including community discharges for Lagos State from September the 11th. Nigeria now has a total of 199,538 confirmed cases. 2,009 people have been discharged in the last 24 hours, increasing the total number of recoveries to 188,427. Deaths have surged within the last 24 hours as the NCDC reported 21 additional deaths, raising the fatality toll to 2,619. Presently, there are more than 8,000 active cases in Nigeria, while over 2.9 million samples have been tested so far. Over 4 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.6 million persons have been fully vaccinated so far. The total global confirmed cases have now surpassed 225 million, while more than 4.6 million deaths have been reported.
The National Primary Healthcare Development Agency is planning to introduce COVID-19 vaccination exercise in churches. The Executive Director of the agency, Dr. Faisal Shuaib, who disclosed this at a meeting with Christian leaders in Abuja, explains that the move is to ease the vaccination rollout across the country.
This meeting is between officials of the National Primary Healthcare Development Agency and some Christian leaders, and the reason for the gathering is to explore the possibility of getting the message of vaccination to churches. Government officials appreciate the role of religious leaders in sensitizing their followers on containing the spread of COVID-19. Now, they want their support with one of the new measures they are putting in place.
I want to task you to be role models to your followers and encourage them to be fully vaccinated against COVID-19. But then, let me say that even after vaccination, please continue to observe the non-pharmaceutical preventive measures. I am glad to inform you that from this phase 2 of the COVID-19 vaccine rollout, we have introduced Sunday vaccination. This is to ensure members of the Christian community who may not have had access to the vaccine for whatever reason are given the opportunity to be vaccinated at their worship places.
One of the Christian leaders agrees with their suggestions and promises to push the Enlightenment campaign.
We know that faith leaders have the capacity, they have the moral authority. People believe in their pastors, people believe in their preachers. And when the preacher says, everybody rise, everybody stand up without saying point of objection. And so they have moral authority. And with this group of people, we can do so much.
According to the National Primary Healthcare Development Agency, over 2.6 million Nigerians have been fully vaccinated. But the country needs to vaccinate at least 111 million people to achieve herd immunity. Hopefully, this engagement will help ensure that the target is met.
Meanwhile, in Edo State, starting tomorrow, 15th of September, civil servants will only be permitted to enter their offices for work if they produce valid COVID-19 vaccination cards. Those without their cards are to be sent home, after which their fate will be decided by the state government. This follows the announcement by the governor, Mr. Godwin Obaseki. The head of the enforcement team and a member of the state's COVID-19 response team, Mr. Haruna Yusuf, further explains that the first phase of the enforcement will be limited to state and local government officers alone, adding that the enforcement teams will carry along scanners to authenticate vaccination cards.
We have trained special teams, 20 special teams. And these special teams will be spread across the 18 local governments of Edo State. What we're going to do tomorrow is to assess those who have authentic vaccination card access to their government working places, and those without can go back and work from home. And government will know how to deal with all of that. So, as from tomorrow, the 15th of September, at all the state facilities, Government House, the 18 local government secretariats, the state civil secretariats will be manned by these special forces who will be saddled with responsibility of scanning and confirming the authenticity of these vaccination cards, and also diligently asking those who do not have their vaccination card to go and work from home.
Professor Yewale Tomori is a professor of virology. He's with us now. He joins us virtually. Thank you for joining us on the program. Always good to have you. Let's start from the position in Edo State and what a few countries are doing as well, insisting on compulsory vaccination. What are your thoughts on this policy of vaccine mandate?
Thank you very much. I think the countries that are doing it have ensured that the vaccines are available to their people. You have access to the vaccine. If we don't have access to vaccine with what we are having here, I think that their rule is premature. I think the first thing the government needs to do is to ensure that the people have the vaccines. And it is only when you refuse, when the vaccine is available, when you refuse to take it, then you can bring in your mandate. Before then, you are putting the cart before the horse. What is the government doing to ensure that the vaccines are available to everybody who needs it? That's the question we'll be asking. I mean, I have nothing against the mandate, but it should be only after you are sure to work.
Prof, if to get to herd immunity for a country like Nigeria, we'll need to vaccinate over 100 million people, how long do you think it will take us to get there at our current speed?
At the rate we're going, if we don't do better than we're doing, it's going to take us forever. I mean, I'm sorry to say, but
oh dear, we seem to be having an audio challenge with the professor, but hopefully we will try to talk to him, to get a hold of him and more clearer visual. But let's go over to Taraba State, the state's primary healthcare development agency. It has received additional doses of the Oxford AstraZeneca COVID-19 vaccine, over 8,000. Though the agency is lamenting the increasing spate of insecurity, difficult terrains and the rainy season, it is insisting that the exercise will be seamless to avert the expiration of the vaccines.
We have already received 8,150 doses of Oxford AstraZeneca vaccine, which we are working with now. But I want to assure you, based on our own calculation, there's every tendency we may most likely before middle of next week request for more vaccines, both for the Oxford AstraZeneca vaccine and for the Moderna vaccines. What we even started doing now is we have started doing what we call strategic redistribution of our vaccines. Local governments that have met up their target and they have quantum of vaccine at their disposal, we have redistributed the vaccines for them to give to the neighboring local governments for them to continue using, looking at the time lag of the expiration of the Oxford AstraZeneca vaccine, because we don't want any vaccine to expire at our doorsteps. That also implies with the Moderna vaccine. And we are working assiduously with our logistics working group and our team, both at the state and the local government, to ensure that we exhaust our vaccine before the end of next week, and if possible, put another request for more vaccines for Taraba State. We can't say we don't have challenges, though this time around the exercise is seamless, considering the fact that the required logistics, both from the National Primary Care Development Agency and UNICEF being a partner that is supporting the state, have already been given to the state.
I'm just told we have Professor Yuale Tomori, who's since joined us again. Thanks, Prof. Perhaps network issues, but let's continue. Your thoughts on achieving herd immunity.
Yes. Yeah, as I was saying, I said we need 100 million doses. I think we've got about 10 million in the country so far. About 2 million people have been vaccinated, according to them. So we're looking for almost another 100 million to go out of 111. And if at the rate we're buying the vaccines, it's going to take us forever to get to that so-called herd immunity. What's the government doing? They should give us information. How many vaccine doses are they getting? When are they going to get it? Then we can be able to say, by this time, we'll get this. They're appealing to everybody now, which is the right thing, the churches and all, get vaccinated. But do you have the vaccines when these people come out to ask for the vaccines?
Still on vaccines.
What steps are we taking to ensure that we have these vaccines with us?
Professor Tomori, if, for example, the Oxford AstraZeneca, WHO has recommended 2 doses in terms of the dosage given intramuscularly with the interval of 8 to 12 weeks, what happens when someone takes it for longer, so longer than 3 months? Is it still potent?
Ideally, with vaccines, different issues can occur. The original discussion, when they did the clinical trials, was within 4 weeks, 3 weeks. But then they discovered that the longer you stay, about 10 to 12 weeks, you are more likely to develop a higher immunity. We don't know exactly what will happen beyond the 3 months, but definitely I have no fear that if you get it after the 3 months, you are likely to get a booster in immunity. You're not going to lose what is on there. You remember, for some of the vaccines, we take like 1 year after the vaccine before you get it. So I don't have any fear about that, whether you get it 3 months or 6 months after the infection. After your first dose.
Finally, do you agree with the health minister? At the Presidential Steering Committee briefing yesterday, he said the dreaded third wave of COVID-19 may appear to be leveling out. He says because there's been no catastrophic increases in infections and fatalities. Well,
from the data we have, you would say yes. But then you'll have to take in the context of the fact that of the 36 states that we have, on the average, only about 13, 14 are reporting. Are the others reporting? Are they testing? We don't know. And this is the issue. The argument is that if the people are falling sick, they come for tests. But then it is not those who are sick alone who are infected. There are people who are infected who do not show signs. And we need to know those ones. Those must be the dangerous people who are actually spreading the disease because they assume they're not spreading the thing all over the whole place. So until we have adequate testing, we're sure that all of the remaining 28 or whatever number of states that are not testing are actually testing. Then before we can say it appears that we are over the numbers will not be that catastrophic. It's possible, but you cannot say with confidence since only 1/3 of your states are reporting regularly.
Professor Yuale Tomori is a professor of virology. Thank you. Always appreciate your time on the program.
Thank you very much. It's my pleasure.
Still to come, United Kingdom to roll out booster jabs for over 50s and vulnerable adults next week. Please stay with us. Welcome back. In an effort to provide better hygiene for Yobe residents, the state's Rural Water Supply and Sanitation Program, with support from the African Development Bank, has provided over 4,000 water points and sanitation facilities. The program manager, Mohammed Maman, disclosed this at an advocacy visit to 14 emirate councils of the state. According to him, every society and government must have interest in providing environmental hygiene to its citizens, noting that many have died of hygiene-related diseases, especially in Africa.
The program is coming to an end, and there is the need for the people in the community, especially the Wishkom, to have a very good knowledge, a very good understanding that there is the need for them to know that this facility that has been provided to them should be taken care of. We have about 2,900 water points that we have constructed, and we have about above 2,000 number of sanitation facilities also that we have provided. So you can see that it's quite a large number, and if these facilities are not taken good care of by the beneficiaries of these facilities, I believe me, there will be a lot of problems.
Away from Nigeria, the UK is incomparably better placed to fight coronavirus now than it was last September, despite cases being higher because of the high level of vaccinations and antibodies in the population. A statement from Prime Minister Boris Johnson. According to him, Plan A is to continue to boost vaccination numbers, ask people to think about using face coverings, wash hands and get a test. Mr. Johnson also said there are 5 million more people who should be getting the vaccine, and that government will keep in reserve extra measures to tackle coronavirus in the autumn and winter. Well, here's more on that story and the global COVID-19 update.
Secretary of State.
Britain's Health Minister, Sajid Javid, says the government has accepted a recommendation from health officials that COVID-19 vaccine booster shots should be given to all vulnerable people and those aged over 50.
Nobody needs to come forward at this.
The announcement came as he set out to Parliament a Plan B for dealing with the virus if the situation worsens. More than 80% of British adults have had both doses of the vaccine, but with restrictions eased, new daily infection numbers are regularly running at more than 30,000.
I can confirm that I have accepted the JCVI's advice and that the NHS is preparing to offer booster doses from next week. The NHS will contact people at the right time, and nobody needs to come forward at this point. This booster program, it will protect the most vulnerable through the winter months and strengthen our wall of defense even further.
An outbreak of the Delta variant of COVID-19 that is thought to have begun in a primary school in Putian in China's southeast continues to grow, prompting authorities to impose measures, including travel restrictions and school closures, to curb the spread of the virus. Putian, a city of 3.2 million in coastal Fujian province, has ordered the testing of all residents after cases linked to a man who returned from Singapore ballooned into a province-wide outbreak of more than 100 people.
We need to have somebody.
The Indonesian health minister says the country will consider reopening its border to the world after at least 70% of its targeting population received the first dose of the COVID-19 vaccine.
So now we have 74 million. We will hit 140 roughly and on the paper. So after that, then we can gradually open, and hopefully if we can get 70% second dose of the target populations, hopefully is between February or March, that it should be, we are more relaxed.
Over 4 million COVID-19 cases have been confirmed in Indonesia, making it one of the worst-hit Asia countries by the pandemic. But cases in the biggest Southeast Asian nation of 270 million people have declined significantly in the past month after peaking in mid-July. And finally, in Russia, President Vladimir Putin is self-isolating after coronavirus cases emerged in his inner circle. He has cancelled plans to appear in person at a regional summit in Tajikistan later in the week.
Well, let's now zero in on the United Kingdom's extra measures and plans for later this year. Joining us, Dr. Peter Moesi is a research fellow with Aberdeen University. He joins us now from Scotland. Thank you for joining us on the programme. What do you make of the government's strategy, how to get through autumn and winter as safely as possible?
Thank you for having me. I think the government's strategy when it comes to the rollout plan and as regards to winter, I think we're well prepared. One, we have aggressive vaccination program. Then two, we have the test and trace and isolate program also involved. Then we have the PCR testing for people who are symptomatic. Then the lateral flow test for people who are asymptomatic. Then also we have the antiviral therapeutics already within the NHS. Then we also have the government support for the NHS, where 5.4 billion was injected into the NHS recently, and 1 billion as well to support the NHS as well. Then also when it comes to the 5-fold plan they have when it comes to addressing COVID-19 during the autumn, we also have the idea where people will be encouraged to use a face mask, hand sanitizers, or wash your hands and keep physical or social distancing. Then a more robust plan to support the international community to ensure that the emergence of new variants are a little bit averted over time.
Is the idea of booster shots to roll out next week in England and Scotland, do you agree with it? And this is also in view of other studies saying scientifically it isn't needed, although one of the scientists at the Prime Minister's briefing said there is clearly a big increase when there is an extra, that's a booster shot in antibodies.
When it comes to the booster shots, I think the science community is a little bit divided on that particular route, and the same goes for WHO and the recent viewpoints that was published in the Lancet journal. Now, the argument is, what is the benefit when it comes to the boosting of this immunity? For instance, people who are immunocompromised, they may likely not have significant level of antibody compared to the first and second dose they had initially. Then also, when you look at the current pandemic across the globe, there are a number of persons yet to receive the first jab. And when it comes to the emergence of new variants, we know that such variants will always emerge from populations that are yet to be vaccinated. Then also, I think for me, when it comes to the booster dose or the third dose, for instance, is that we need to stratify our data, and that stratification is based on the age demography, who are the people more vulnerable, and the age demography as well. But again, when you look at those parameters as well, like I said initially, a first and second dose compared to a third dose for people who are immunocompromised may likely not give a significant effect when it comes to the level of antibody you have also. And don't forget that the immune system is a little bit complicated. And what that means is that you do have other parameters that may likely enable you to fight off the virus. An example of that is your B cells and the neutralizing antibody as well. So it's a little bit, I think, hasty decision going forward when it comes to the booster dose for wealthier nations where you have middle and low income countries yet to receive just one jab.
What would be or should be the trigger for Plan B?
So the trigger for Plan B in the UK is going to be, one, the behavioral pattern of people, also the overwhelming cases in the NHS when it comes to hospitalization and death. So when we have these parameters in place, then the government can say, you know what, we're going to have a mandatory face mask restrictions, a few break in lockdowns here and there. And at the same time, people will be mandated to take jobs, specifically people responsible for care jobs and the NHS staffs as well. But for now, if people behave accordingly, I don't think Plan B may likely kick in.
Finally, Dr. Moesi, I mean, at the end of the day, do you see a transition in the UK from pandemic to endemic?
Yes, I would say yes. I see that clearly because there's a study currently ongoing in Oxford University where we are trying to check the number of people with this antibody in the population based on the natural infection and vaccine-induced immunity. So in the coming days, we're going to tell if we have a significant level of people already exposed naturally and those with the vaccine-induced immunity. And going forward, we do know that in the next couple of weeks or months, people will likely be infected with this virus. But the good news is we do have the remedy when it comes to the vaccine that are still holding up when it comes to severity, hospitalization, and death. And that, again, is reassurance for the general population to say, you know what, despite all of the challenges coming forth, we may likely push this pandemic to an endemic situation in the next couple of weeks or months. But that's still based on the behavioral pattern of people and also other developing countries around the world having one jab of this vaccine as well.
All right, we always appreciate your time. Thank you so much, Dr. Peter Moesi is a research fellow with Aberdeen University. Thanks again.
Thank you for having me.
The coronavirus can live on the surface for several hours. Continue to take responsibility. Avoid sharing personal items. Disinfect frequently. Wear a face mask. Wash your hands. Maintain a distance. You can visit our website. It's channelstv.com for more updates, a better understanding of the pandemic. You can find some breaking news as well. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.